What exactly is your steps if you should come upon an emergency? And by the way, it doesn't have to be like a car accident. It can be you just find somebody unconscious. It could be drowning. It could be any number of emergency type situations where you have to act. The bottom line is you have to do something. Well, I take that back. Legally, do you have to act? No. It is a choice that you have to make. But I'm just saying this is the process. Should you choose to act, these are the things that you will need to look at. Number one, and we've talked about this, checking the scene. Because what we don't want is for you to be a victim as well. Before you do it, and this is a test question, actually. And we really haven't talked too much about it. Before you start giving first aid to anyone, you make sure that there aren't multiple victims. And the reason for that is because you could come across the first victim and think that you need to stop and give them first aid, but there could be another victim that needs it worse. This person may be bleeding, or they may be burned, or they may have a broken arm, but the other person may not be breathing. So you need to first check to see if there are multiple victims before you ever start giving first aid to anybody. And if there's two or more of you, then you let somebody else say, here, stay with this victim. Let me go see about this other person or whatever. If there's two or more of you, then you can divide up and look for those victims and take care of each one of them individually. Look for clues to determine what happened. Remember, you're checking the scene. Is this a car accident where they hit a pole? Is there downed power lines? Is there gas leaking? See what happened, because that gives you a clue as to how safe you are or are not. Look for bystanders. If you're by yourself, here comes a car, flag them down. Whatever you can do to find someone to help you, because you may not be able to handle this situation by yourself, or it would be better if you didn't have to. Look for hazards that may put you in danger as well. And if you see any kind of danger, if you smell gas, you smell or see smoke, there's broken glass, anything that could put you at risk, then you just stay away. You are not obligated to help if it puts you at risk, okay? So let's look at this picture right here. I know it's not big, but let's look at it and determine. Now, this is a scene of an emergency. So tell me what things, if you were standing right where the person who took that picture was standing, those people obviously are first responders. They know what they're doing. But let's say you were there first. You were right behind, and I think that's a bus. You're right behind that bus. So you were there before any of those people got there. Just looking at the scene, tell me some of the things that you automatically know could be a danger to you. What? Okay, there could be gasoline leaking, and the bus could explode into flames. What else? What?
Shattered glass from the windows.
There could have been shattered glass. I mean, we can't see that much, but you know that's probably a possibility. Alex?
Bus could roll.
Yes. It is on a hill, and it is sideways. You can see it slanted a little bit. And depending on the weight on the right-hand side of the bus, it could topple. And if you're right there where they are, that would obviously put you in danger. What else? Come on, the most obvious thing. Yes, thank you. Power lines are down. Do you see them right there? Power lines are down. Anything else? That's enough. I mean, if nothing else, just the power lines by itself, just the fact that it is possible for the bus to roll over, that's enough right there. Okay? So your job in a situation like that would be probably to stay away right like where the picture was taken, call for help. Let somebody else do it. Okay? All right, so here, and you honestly, you don't have to write this. I just want you to be aware of the different hazardous situations. Traffic accidents, obviously. Fires, you don't go into a house that's full of smoke or that is on fire, down power lines. Water and ice hazards. Ice we don't have a problem with. Water we do. We have a lot of water. We have a lot of unprotected water. We have pools. We have ponds. Lots of you have ponds in your backyard, especially with younger kids. We have the beach. Again, a lot of open water with unprotected areas. Natural disasters. I mean, we've had this summer we had all kinds of water spouts. Water spouts are basically what? A tornado over water, but if it comes on land, we know what kind of damage that can do. And we've seen where the tornadoes have come through and touched down in areas of Tampa Bay and have destroyed buildings, and even things like, carports or trees fall on power lines. Those things, you have to look out for any of that stuff when a natural disaster happens. Hazardous material. What would that be? Hazardous material. Chemicals. Okay, so let me ask you this. Where are you going to see those things? Where are you going to come in contact with any of those hazardous kinds of materials? Where would you be that you could possibly be in contact with any of those hazardous materials? Come on. No, not really. Let's think about traffic. What do you see? Come on. Hazardous material. Hazardous material. In traffic. What?
Sewers. That's what I said.
What do you see when you're in traffic that gives you an indication there is hazardous materials?
Flashing lights.
What? Say it, Alex, what?
The flare things, like,
Oh, flares like if there's an accident? No. I mean, that's true, but that's not what I'm talking about. Guys, tanker trucks that have those diamond-shaped, those placards that are on the back, and it'll have a picture of a flame. What does that tell you that's in that tanker truck? Something that's flammable, okay? There are also placards on the back of some of those 18-wheelers, or even train cars, tanker train cars, and they indicate that there's corrosives. So if you touch it, it's like acid. So there's all kinds of Listen, somebody told me one time if we had any idea, because we have the port down here at the end of I-75, they get on I-4, they go to the port where a lot of that hazardous material comes in on ships, and they put it in those tanker trucks, and the only way to pretty much get it out of here is straight up I-75. Somebody told me one time if we had any idea, I think it was a paramedic, if we had any idea what all kinds of crazy stuff they were transporting in those tanker trucks up and down our interstate, we'd be scared to death. So watch for, just now that you know, when you see those 18-wheelers, look for those. You know what I'm talking about? They're diamond shaped, and some of them say, flammable, some of them say corrosive. There's all kinds of them. Actually, in the book, you've got a whole half a page of those different kinds of placards that are on either train cars or on 18-wheelers. And so what is the danger of that to you? Right. Or even somebody else does. But if that thing leaks and that leaks out into the atmosphere and you're stuck because the accident's happened, so now you're stuck in dead stop behind the traffic accident, and that stuff's leaking out, everybody's at risk. So hazardous material is an issue for us as well. Unsafe buildings. Unsafe buildings after a fire, unsafe buildings after a tornado or hurricane. Those are also places that you have to look at for scenes. Any kind of wreckage. How about suicide? How in the world is that an unsafe scene for you? I want you to think about what I just said. We're talking suicide. Someone has attempted suicide. What could be a scenario? If they are or have attempted suicide.
it means they don't want you to stop them.
Yes, that is correct. They don't want you to stop them. Hostile victim or family. Hostile means, okay, so hostile victim or family, what could be a scenario there that would put you at risk? Well, carry that a little further. Yes, somebody with a gun threatening a family member, somebody taking somebody hostage, abuse, in the family and you try to step in and help, that's not what you need to do. You need to call somebody. Okay? Here's another picture of a hazardous scene. What's happening? Okay? So what for you is the risk? Okay. Trying to get to those victims through that rushing water, and you without any kind of equipment. You know, you've got somebody that's in the car screaming, help me, help me, help me, and you really would like to help them because, you know, that's what we do. We're good Samaritans. And you attempt to do that, and then you're washed away before you can even make it to the car. Even people who are professionals have a difficult time with situations like this. A lot of times you think, well, it's just water. How bad can it be? It can be bad. It can be bad. And unfortunately for us, we have a lot of this kind of thing. We have roads that flood all the time, especially when we have hurricanes and rainy seasons, and it can be extremely dangerous. Okay? So, number one is check your scene. All right, let's look at number two. Number two, you're going to call 911 and you're going to follow the directions. Remember, you're not going to get in trouble for calling 911 even if you don't need to. Now, I'm not talking about making a prank call. I'm talking about if you call and say this is what's going on and they talk you through it and they figure out that, you know what, you're probably okay to take that person to the emergency room without sending a unit, then that's what they may tell you to do. But you're not going to get in trouble if they say to you, you know what, you can handle this, just, you know. Most of the time they're going to send somebody anyway. They're not going to take a chance. Why would they not take a chance? And then? Yes. No, not sue you. You sue them, yes. They would rather be safe than sorry. So most of the time, regardless, they are going to send a unit to you. But do what they say. That's the bottom line. And don't hang up the phone. Number three, check the victim. So you have checked the scene. You know that it's safe. You have chosen to help. You've already got 911 on the way. So the next thing you're going to do is you're going to check that victim. And what you're going to check for first is what? No. Life-threatening injuries. That is excessive bleeding, like spurting blood, because you know that's what? An artery, okay? You're going to check for circulation, and you're going to check for breathing. You want to, anything that's, you know what, if they've got a broken leg, yeah, that's bad. Or if they've got, a bashed in head, that's bad. But the bottom line is they'll live through that. But if they are bleeding to death, or if they are not breathing, or their blood is not circulating, that is life-threatening. So you check that first. If then there are none, then you look for minor injuries. Are they burned? Do they have a broken bone? Are they going into shock? Are they having a seizure? Things that aren't particularly life-threatening but do need to be addressed. But you look for the life-threatening things first. Okay? And that's just an example of checking for breathing, which we'll learn how to do. And then remember that you do not move that victim unless it is necessary. Tell me a circumstance under which it might be necessary for you to move the victim. What is it?
You hear gas.
If you hear gas leaking or hissing, depending on what kind of gas it is, what else? Why else would you maybe need to move them? If a fire starts, why else? Anton? Power lines swinging around. Why else? What if it's a car accident? They're in the middle of the road. You got to get them out of the middle of the road. Okay, what is your biggest fear when it comes to moving a victim? How would you hurt them more? Yes, in case they should have a spinal or neck injury. So what we're going to do is learn how to assess for that and learn how to move them as carefully as possible, because this is one of your biggest fears when it comes to negligence. You don't just jerk them up any way that you can and move them. Now, if they're moving themselves around, they're moving their legs and they're moving their arms and they're talking to you and they, you say to them, can you feel your arms and legs? Yes. Then, you're probably all right to pick them up any way and move them. But, those may be questions you have to ask first to give you an indication that they may have an injury. And we'll talk a little bit more about that. Okay? So your fourth order of business then is going to be to give first aid. So you've checked them for life-threatening, you've checked them for minor injuries, and now you've got to actually do something, possibly, for them. If they are not breathing, or if their blood is not circulating, you have to give life support, which is CPR, or rescue breathing, or the use of an AED, or all of the above. Depends on what's wrong with them. If none of those things occur, then you're going to check for minor injuries. If they're having a seizure, how you do that. If they are bleeding, stopping the bleeding, putting pressure on it, putting a bandage on it. If they're going into shock, elevating their feet, all those things that we're going to talk about. So whatever you need to do until somebody gets there to help you. This was a question on your test as well. You do not give a victim medication. The only time that you would do that, give me an example. Well, if you think they're having a heart attack and they can say to you, I have some medicine in my pocket, and it's usually what we call nitroglycerin, and they put it under their tongue, and they direct you to do that. Because remember, a person having a heart attack can still talk. What they're doing is they're experiencing shortness of breath and lots of pressure in their chest, but they're still conscious and they can talk to you. Now, if they are unconscious, you're certainly not going to give them medication. So if they are conscious and they say to you, I've got aspirin or whatever, and they can tell you that, who else could tell you what to do? Besides the heart attack, that you could give them medication? No. What other kind of victim? A diabetic. A diabetic could tell you that they need some sugar. That is before they pass out. Now, if they pass out, that's a whole different story. They can say, either I need some sugar because my blood sugar is low, or I need some insulin. Can you get me my pack and give me a shot? Who else might tell you that they need something? What other victim? Somebody with an allergic reaction. What would they tell you? To get their EpiPen. Other than that, you don't say, here, let me give you some Tylenol to help with the pain. You do not give medication unless it's one of those other three incidences, just so you know. Okay? And then the fourth thing that you're going to do is have that victim, if you don't call for help, they still need to go have medical attention. They need to either go to urgent care or go to their primary physician. For example, if a person is just choking, you're at a restaurant and they are choking, and you do the Heimlich maneuver on them, those people still need to go get checked out. Why? Even though you get it up and they appear to be fine, why do they still need to go be seen by a professional? What could have happened? Really? They're choking on something. You got it up, and they appear to be okay. They still need to go get checked out. What could have happened in that process? Couple things. No, I hope you didn't break a rib, because you shouldn't. If you're doing it right, you shouldn't break a rib. What did you say, Anton? Did you say something? You need to stop with that. Seriously. What else? What would have happened? What could have happened to that person when they were choking?
Something bad.
Say it again.
Something bad.
That is such deep thinking. Anthony, I'm so proud of you. Dig deep, man. Dig deep. I know it's in there. A little portion, a little tiny piece of something that they were choking on could have broken off and got into the lungs. It can't stay in there. The only way you're going to know if it's in there is an x-ray. They may not feel it, but if it breaks off and it lodges in the lungs, it's got to come out. Or, depending on what it is, like if it were something sharp, like a chip, it could have cut the esophagus, and now they're bleeding down into the stomach, and they may not know that. So even if you get that up and they seem to be okay, they still need to go get checked out, because you don't know what has happened on the inside. And nothing that gets lodged in your lung can just stay there. It's got to come out. Okay? So they need to go. You got to go. All right, follow up. Let's say you provided care. for somebody. What's going to happen next? First of all, you need to be prepared to answer some questions. The who, what, when, where, how. What did you see? What was the first thing that you did? Who was there when you got there? Was the victim conscious and then they went unconscious? Were they unconscious and they came to? You need to be prepared to answer questions to the paramedics or to a highway patrol or to a parent or whomever, depending on what the situation is. And I would suggest to you that legally it would probably be, in case there's any questions, the best thing for you to do once it's all over with is to just jot down the whole situation in case you were called back by the highway patrol or you were called back by, I don't know, maybe they try to sue. Maybe it's not you they're trying to sue, but maybe you were a witness to the accident when it happened, and as such, they're going to then call, because one is suing the other, so you're a witness, so they're going to call you as a witness, and it could be months later before that happens. So you need to write that stuff down and keep it just in case, so that you don't forget what happened. So write it down. Lost connection for a minute. Okay, what if it's a crime scene? What if you either are involved in a crime scene or you come upon a crime scene or you're just somewhere and all of a sudden, I don't know, somebody assaults somebody out of nowhere like at McDonald's or somewhere, If it's a crime scene and it's assault or abuse or domestic violence in somebody's home it could be a number of things. But the bottom line is it is a crime scene. What do you do? Okay, first of all, do not touch or alter anything that could be possibly used as evidence at a crime scene. I'm thinking that you've watched probably enough crime. Hello? Brandon? You've watched enough movies about crimes and crime scenes that you ought to know that. But you do not touch anything. Do you need to go somewhere, Brandon? Yeah. Okay. Don't touch anything. Don't alter anything. Don't move anything. Because all of that is evidence in solving that crime. Do you know what an assailant is? What's an assailant? Assault, assailant. Who is the assailant?
Criminal.
Yes, the person who does the assailing, commits the assault. Okay? Be prepared to describe them. It was a, 50-year-old male with a beard. I'm just saying, have some idea of at least what you saw. If you didn't see it and you can't recall, that's one thing. But, pay attention to those things and be prepared. Describe the first aid given, if any. Say, yes, when I first got there, I saw that he was bleeding, so I got some towels and I did, give him first aid. I did put some pressure on it. I tried to stop the bleeding, but I just couldn't. Or whatever you may have done. And then whatever they ask, cooperate fully with them. Help them to make sure that, whatever crime has been committed, that they can solve that, and whoever's responsible can be held without question about what they've done. Okay? And you just, unfortunately, these days, you could be sitting at McDonald's enjoying yourself a big bacon cheeseburger and a big old soda, taking in about 6,000 calories that you do not need, and some crazy person comes in and starts shooting. It happens. It's on the news all the time. So you don't know. You can't sit there and say, I'm never going to be in a situation like that. You don't know that. So I'm just saying, be prepared for, whatever. All right. Here's the thing that we have not addressed that needs to be addressed, and that is coping with a traumatic event. This is not, I would never sit here and say to you that this would be an easy thing to deal with. You just deal with it and go on about your business. That's not going to be the case at all. That is not going to be the case. Seeing someone really injured or hurt or even possibly dying right there before your eyes is considered a traumatic event. And you're going to have to deal with that. You don't just walk away unscathed. It would be nice if we could, but we aren't made like that. Now, you don't necessarily have to write this part right here. It is particularly stressful, and I think you probably know this, if there are multiple victims, like it's a huge car pileup, or somebody starts shooting and 3 people die. Multiple victims makes it multiply stressful. If there are children involved, like abuse, if it's a domestic violence and it's abuse and it's children, if somebody is abused or neglected and you come upon that situation, if it is friends, if it is family, if it is co-workers, that makes it, even more stressful than if it's strangers. So, even if it is a stranger in a car accident that you have to stop for, and you don't know them from anybody else in the world, it's still going to be a traumatic situation for you to have to deal with. So, you do need to write this. These post-traumatic symptoms. This is really not much different than what we hear on the news about military people who come back from war and they have post-traumatic stress syndrome because of what they've seen, maybe what they've even had to do, and how they cope with it or how they don't cope with it. And so some symptoms might be irritability, like snapping everybody's head off. When you really don't know why, it's like no one's done anything to you. It's just that point of irritability where you can't really control yourself. Sleeplessness, lack of concentration, anxiety, depression, and even physical symptoms. Stomach aches, headaches, backaches, vomiting for no reason. These are all symptoms of post-traumatic stress syndrome. And it can be, depending on what you've dealt with, it could be mild, I know that, 2 years ago, when, right here at school, when Coach Bunnell passed away from a heart attack right out by the portables, there were students and there were teachers around that dealt with that situation, that helped with that situation, and they had a really hard time dealing with it afterwards. That's post-traumatic stress syndrome. Theirs was not like people who come back from like Afghanistan and they've seen, villages wiped out from, craziness. But the bottom line is they had to figure that out. They had to deal with that. And so it's the same exact thing. Here's the thing that you need to know is there are ways to work through it. But I will tell you that you probably will not be able to work through a situation where you've had to help with a car accident or somebody had a heart attack. You're probably not going to work through it by yourself. And that's okay. No one expects you to. First of all, it is okay to talk to somebody. If you're comfortable talking to your parents about it and you're comfortable breaking down in front of them and crying and getting it out, that's fine. And it may be that you need to see a counselor. And guys, listen, there's absolutely nothing wrong with seeing a counselor in any shape or form. If your parents divorce, if, whatever. There's no shame. There should never be any shame in trying to get help. 99% of the population of America either has seen a counselor, is seeing a counselor, or will see a counselor at some point in their life. So it's not like you're alone. So get help if you need to get help. It's okay. The second thing that probably is going to occur is that you need to remind yourself that it's a normal reaction. Post-traumatic stress syndrome is a normal reaction to dealing with a trauma. It's not like, oh my gosh, there's something wrong with me. No, there's nothing wrong with you. We would all do the same exact thing given that situation. So it's not like you have to worry about your reaction being unnormal. It's not. And then if you need to seek professional help, if you need to seek a counselor or a psychologist or even a psychiatrist, then do it. But you have to work through it, and you may need help to work through it. Questions? I hope, honestly, in my 58 years of living, probably the worst thing I've ever had to do is, and it's been in my classroom, all the emergencies, other than little things with my kids scraping me and things like that. I've never had to do knock on wood, I've never had to deal with them. car accident or somebody having a heart attack, you know, seizures in my classroom and kids passing out in my classroom, the bicycle accident that the kid had, but nothing really bad. And hopefully you won't ever have to do it either.